Hello, I would like to start by thanking you all for attending this special event. This event, which is organized in honor to our friend late Dr. Yasser, the man who established the profession of mental health in Palestine and was a defender of principles of peace, justice and human rights in Palestine and worldwide. He was highly recognized by receiving many international awards in recognition of his significant contribution to the principle of peace and respect of human rights. We are committed to continue his mission and path. I take this opportunity to thank Gaza Mental Health Foundation in USA, our twin organization, for their key work in supporting us and Palestine. Special thanks to Dr. Nancy Murray, Dr. Bill Slaughter, Dawn, and all the group for their commitment and continuous support for the people victims of oppression and justice. I would like to introduce myself. I am Yasser Abujamei, a psychiatrist and the Executive Director of Gaza Community Mental Health Program. In few months, Gcmhp will be celebrating its 25th anniversary. When we look back, we find big achievements despite the challenges, and there are many. The first and the most important is the Israeli occupation, the oppression, siege, and torture that Palestinian people endure over the years. Since its work, Gcmhp hoped to serve all population in Gaza by different means, give psychosocial support for those who need it, build capacities in the governmental and non-governmental sectors, establish for research work on one hand, while spreading awareness and defending Palestinian rights on the other hand. A month ago, Israel has launched a brutal offensive, the third of its kind in the last 6 years. The offensive was of large scale with extreme psychological impact on children and families, whether this impact is related to the long sense of insecurity or traumatic events themselves or the huge loss of people and property. My own family, my own extended family, suffered 28 dead at one time in one single strike by an Israeli jet fighter, killing 28 people, including 15 children and 3 pregnant women. War and violence cannot solve any problem. On the contrary, it provokes anger, hatred, and counter-violence, and establish for a new cycle of desire for revenge. It's our mutual responsibility to break this cycle, and break this cycle. Peace is the answer. Just is the key. We are not only clinicians in the rooms, we are also advocates for justice and human rights. We need an overall decent human rights structure to benefit our whole people. So we clinicians here can stop the exhausting work of individual new horrendous case after individual new horrendous case. That is no solution. Now Gcmhp rule is needed more than ever. The suffering is huge. We have to dignify the dead people, and the most important is to take care of those who are alive. We are responding with crisis intervention, where we visit families affected by the war and provide them with psychological first aid and refer cases who need further specialized intervention to our community centers. We also train many other professionals with many other organizations who don't have so much counseling background, working in the community and supervise their work. We also educate the general public about how to deal with their agonies and problems. We try to help the Palestinian family to be powerful and cohesive, to increase their resiliency. We need your support to be able to help our people and to build peace in Palestine and try to prevent further cycles of violence. Dr. Iyad has taught us that the core goal of Gcmhp is to make people feel like they are regaining their dignity. This is why we see ourselves as community workers and the human rights advocates, not just clinicians. Once again, thank you. Thank you all tonight. Thank you, Gaza Mental Health Foundation. Thank you all our friends and supporters in the States. Thank you for all your efforts to help us. Helping one human really helps all of us worldwide.